Similac NeoSure is complete nutrition for babies born prematurely. Our post-discharge baby formula has increased protein, vitamins, and minerals compared to term infant formula and promotes excellent catch-up growth. This special blend has protein, calories, vitamins, and minerals, including calcium, to help your baby grow. Similac NeoSure is from the #1 infant formula brand for premature babies, *. Excellent catch-up growth, supports better gains in weight, length, and head circumference for premature babies when compared to term infant formula. Supports brain and eye development, has our unique blend of DHA, lutein, and vitamin E to support brain and eye development. Helps support bone growth. Our formula has calcium and phosphorus for babies growing bones. No artificial growth hormones, the first leading infant formula brand with no artificial growth hormones. Contains milk and soy ingredients. OptiGrow is our exclusive blend of DHA, lutein and vitamin E. These important ingredients are found in breast milk. DHA for brain and eye development. Lutein to support eye health. Vitamin E, an important nutrient to support developing cells. Supports excellent catch-up growth during the first year. 1. Increased protein, vitamins, and minerals compared to term infant formula. Increased calories for growth. Calcium and phosphorus for babies growing bones. Supports better gains in weight, length, and head circumference when compared to term infant formula. Preterm infants fed Similac NeoSure through the first year of life showed significantly increased lean body mass and less fat mass at 12 months corrected age. Improved visual acuity at 6 months corrected age. Improved early language development at 14 months corrected age. Lutein, a carotenoid naturally found in colostrum and human milk, has been shown to help support eye health in the preterm infant. 25% of the fat blend as MCTs, an easily digested and well-absorbed fat source. No artificial growth hormones. Gluten-free. Halal. Kosher. Precautions. Never use a microwave oven to warm formula. Serious burns can result. Powdered infant formulas are not sterile and should not be fed to premature infants or infants who might have immune problems unless directed and supervised by your baby's doctor.